Hello, this is Dr. Sean Andrews with Andrews Family Chiropractic, and today I want to talk about disc herniations and disc bulges. This is kind of a hot topic, especially this time of year, when people are potentially making these underlying issues that maybe they're already worse by shoveling and slipping and falling. So first of all, I want to explain what a disc herniation is, what a disc bulge is, what the difference is, and then what are some of the symptoms you may be having if you're having one of these issues. So a disc is made up of two components. You have an outer kind of tough fibrous layer that's called the annulus fibrosus, and then you have the inner part, which is a little squishier. That's the nucleus pulposus. So either through trauma or through just as you age, this part becomes more brittle. The middle part can start to migrate backwards. And as it does so, it can either break all the way through the outer part and land on either the spinal cord or the nerves, and that is called a disc herniation. Or it can just push it backwards and kind of put a little bulge back. So it doesn't break all the way through. These tend not to be as severe in their symptomology, but that's what a bulge is. Like I said, it can either be through something traumatic, or as we age, we naturally have to start to have some degeneration in the discs, and the more dehydrated and brittle this outer part gets because of the aging process, the more likely it is that that nucleus pulposus, that inner part, can migrate backwards, and that can spell a lot of pain. And to explain what sort of symptoms you may be able to expect with this, I'll kind of go over my own history. I've had disc issues, or have disc issues in my lower back. The first time I had just really, really severe low back pain. Nothing in my legs, but it was very, very severe low back pain. And we actually just discovered it kind of offhand while I was on a clinical rotation at an MRI center in the Twin Cities while still a chiropractic student. The second bad flare-up was 7 years ago, and that time I had severe low back pain, but horrible singeing pain all the way down the back of my leg, and my foot went numb, and I could hardly walk. It was just simply excruciating. I was able to get some relief, which is what we'll talk about is the medical versus the chiropractic treatment protocol for disc issues. But just know it can either be severe low back pain, severe low back pain and leg pain. But what we do here is we always make sure we do a thorough examination to make sure we know exactly what's going on as much as we can. Obviously, to confirm any disc issues, you have to have an MRI, but usually we can get a pretty good idea of whether one is present, and then proceed on with a trial of care from there and get an MRI if we need to at a later date. But make sure, so when you do come in, we make sure that we do a thorough evaluation so we know exactly what we're dealing with, and then we come up with a complete treatment plan to get you feeling better and to correct that issue so it doesn't become a chronic problem for you. So that is what a disc bulge is, what a disc herniation is, and what some of the symptoms might be that you might experience if you're having either one of these. Tune in next week where we'll talk more about specific treatment protocols, both in my clinic and medical clinics. So have a great week, and as always, I hope this was valuable for you. Take somebody down below if you think they might have a disc issue and can benefit from talking to somebody in our clinic. Thank you. Bye.